Let's turn now to NBC News medical contributor Dr. Kavita Patel to break down some of these vaccine headlines that are out this morning, and there are a number of them. Dr. Patel, always good to have you. Let's start with this FDA green light, this third shot of Pfizer and Moderna for people who are immunocompromised, roughly 3 million people in this country. All eyes on the CDC because they're set to meet tomorrow. Two questions here. Why would that extra dose be needed? And same question I posed to Dr. Fauci, is it reasonable to expect that soon boosters will be required for everyone?
Yeah, great. Good morning to all of you. Important questions. Number one, that third shot is important and deemed necessary, Craig, because we've got growing data that shows that people with certain chronic conditions and taking certain chronic medications like prednisone, a common medication in high doses, that you can actually have very little response to even the first or second injections, and that over time that response diminishes. So bottom line, and we do boosters for other things. Some of you have probably gotten a tetanus booster. That's something that we have to do every 10 years. So that's one of the reasons we think this third shot could be very helpful. And then to your second question, I do believe that all of us are going to need another shot at some point, whether it's the exact same one we just took recently or a tailored formulation that's tailored for the variants, which the manufacturers are also studying. That is likely to be in our future. Hopefully not too soon, because our current vaccines, good news, our current vaccines are working, and that's good news.
But then, Dr. Patel, this preprint study came out this week from Inference in the Mayo Clinic that showed that the vaccine effectiveness in July, when you put the Delta variant in there and being highly prevalent, Moderna's vaccine, their effectiveness dropped to 76%, Pfizer down to 42% effective against the infection, and of course hadn't been peer reviewed. Pfizer releasing a statement saying it's confident the protection and safety of the vaccine. But should we be concerned about this? It sounds like kind of like our flu vaccine. Each year we take it and we find out it's only 50% effective.
Yeah, Al, I love it that you could be an epidemiology professor. Preprint articles and peer review. I love it.
Not really.
So a couple of things. You highlighted some of the biggest limitations, but what it does show us is something actually that we already know, that we do see immunity decreasing over time. That study in particular was limited to people in Minnesota and compared people who had gotten vaccinated at different points in time. We do know that people who were vaccinated earlier have fewer kind of antibodies now than they did 6 months ago, but that's natural. That's the human immune system. Here's the critical question we don't know. What's the percentage level that's enough? And 42 seems like it's enough because we didn't see deaths and severe hospitalization altered. So remember, the goal of our vaccines was to really prevent those terrible results, and it is working. But it leads to that first point with Craig that I do think we're all going to need some additional shots at some point. It's just a question of which ones and when. For immunocompromised and maybe even for elderly, we'll need them now.
Dr. Patel, this next question hits home for me. The CDC is now urging all pregnant women to get vaccinated, but only 23% of soon-to-be mothers have gotten that first dose. I had a lot of conversations with my doctor because I got the vaccine during my first trimester, and I was hesitant. I was a little nervous to get it because I didn't know the impacts. But she pointed out to me several times that women who get COVID, pregnant women who get COVID, could have very serious complications, whereas you don't see that by just getting the vaccine. So what's your stance on that? And what do you want to tell women who are still on the fence about getting it?
Yeah, look, nothing hits home more for me, because if you've ever had any issues, pregnancy, fertility, miscarriages, you're also thinking about this, keeping your baby safe and yourself safe for your other children and your family. Number one, this has been updated yesterday to update with over 100,000 women pregnant and also women who are breastfeeding and trying to get pregnant to look to see if there was any difference between people who received the vaccine and women who did not in terms of miscarriages or things that we don't want to happen to the baby. And there were no differences, meaning the vaccine did not cause miscarriages. The vaccine did not cause pregnancy complications. We contrast that now with stories of women who were not vaccinated in pregnancy and had worse outcomes. Some, unfortunately, have died. And I'll just say to you, that 23%, that doesn't even touch the fact that for Black women, only 10% have been vaccinated.
Wow.
So we've got some real work to do, some real education, but a real opportunity to save not just women's lives, but their babies' lives, too. Those antibodies can cross the placenta and help protect your newborn.
Dr. Kavita Patel, thank you so much. Lots of useful information there, as always. Do appreciate you.
That's good.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.